Hey everyone, I am your host, Ethan Bradbury. Welcome back to the Desire Talks podcast. So, this is season two, and on the build up to season two, I asked listeners what would they like, what do they want more of, what do they want less of, do they want something new? And an idea was ran by me about getting someone on to talk about sexual health. So, that's what I've done. I've reached out, I've got someone, they're coming on, they're going to talk about sexual health, and they're going to answer your questions. So, usually we talk to porn stars. So, this sexual health discussion is going to be aimed at people normal in civilization, and then people who actually do this professionally, and then how it's going to be different for both. And then, yeah, I'm pretty adamant that most of it actually is going to apply to everyone anyway. So, anyway, let's get our guest on. All right. So, welcome on to the Desire Talks podcast. Thank you for coming on.
Thank you. Thanks for having me.
Do you want to introduce yourself? Tell us who you are, what you kind of do.
Absolutely. So I'm Richard. I'm a sexual health nurse, and I'm here basically to talk about sex, STIs, anything you want, really.
Well, that's exactly what people have been asking for. It's people are afraid to ask a lot of questions, so I thought I'll do it on their behalf.
Yeah, why not? Why not?
So, how long have you been working with sexual health?
So it's going to be nearly 4 years now altogether, and it's a very broad sort of job, but very specialised as well. So I see a lot of different people from different backgrounds as well, and with different conditions, and it's a lot of health promotion as well. So it's a really satisfying job and a really interesting job as well, as you can imagine.
Okay, great. So, obviously, you've had your normal job in the sexual health industry. You've mentioned to me previously that you've done a lot of work with charities as well. How go on? Do you want to talk about them at all?
Well, yeah. Well, there's an organisation called Prepster down in London, and I'm still actually working with them as well. They're doing a campaign called "Ask Me About Prep." It's basically it's to get the conversation going about prep, basically, and we'll go into prep more obviously a bit later on as well, what it is. But the actual organisation itself, it's called Prepster for a reason because they're promoting prep. And yes, so basically, I'm one of the people that basically has that conversation with people outside of my job as well. And they're trying to get people from Wales to really take on board the message as well. So yeah, so that's basically that's the most recent sort of charity that I'm working with at the moment.
That's really quite cool. We're definitely going to go into that and talk about prep because I think it's a
Yeah.
really big topic we need to talk about. But before we do that, let's talk about just generic sexual health testing. So you were saying it's quite a wide spectrum of things dealing with, but it's so niche at the same time. Go on, what do you mean by that then?
Yeah. So if I just give you an example then of like a standard sort of day, what I could be dealing with. So I could be in the morning, I could be triaging someone or doing a consultation about someone that needs a coil, let's say, with someone that with a vagina and womb. And then the next person that I could be seeing could have genital warts. The next person after that could be then living with HIV. So then we could be talking about their treatments and what's going on with them as well. And then again, the next person could have full-blown symptomatic symptoms that could be potential of gonorrhea or something. So it's a lot, and we also do quite a little bit of sort of in-house counselling with patients about psychosexual problems as well. There are
Okay.
charities and like organisations that we can refer to, but we actually try and help people as well if they're having problems.
Could you explain that then? So, what is psychosexual problems?
So psychosexual problems is basically there's an example of something called vaginismus. It's a strange word, but it's people with a vagina. Let's say they may have had unfortunately maybe an assault previously or something negative happened to them previously, and then when they're trying to engage in sex, then their mind tells them this is wrong at the back of their mind, so it then connects to something physical and it tightens the muscles and becomes very painful with penetration. So that then becomes a psychological problem for them, because it's a vicious circle, because they're not enjoying sex, the quality of sex. They end up not having sex, and they're not getting to the root of the problem. So it's just working through, when people say they have pain with sex, that is a symptom of an STI, a sexually transmitted infection, but it also could be a psychosexual problem as well.
I didn't know that sexual health clinics dealt with things like that at all. This is brand new news to me.
Okay, yeah. So it's something that we're always looking out for as well. I mean, we're not qualified counsellors, but in being a nurse, obviously, we do something called holistic health. So like holistic well-being of the person. So if they are suffering, even with like performance anxiety as well, we can talk through different methods to do, different practices as well, and if try and get to the root of what's going on. We also have people as well, people with penises that come in, and they feel that there's like an irritation in their penis, and they're having pain when going for a wee as well. And we've tested everything for them, and it's negative. What it actually can end up being, it's almost an anxiety thing, that because they may have actually been unfaithful with their partner, and they feel in their head they've probably got something now, because it's a guilt, psychological guilt, and that we've seen that quite a bit as well. So instead, we have to recognize symptoms, obviously, of an STI, but we also have to recognize signs of a potential psychosexual part as well with the person.
Okay, so that's really interesting. I was not at all aware that the sexual health organizations anywhere, like I didn't know this was a thing at all. So
they do, some services do have an in-house psychosexual therapist as well. It's more in the inner cities with more funding, but they do. We the service that I work at, we used to, but it's funding. That's where it's down to, of course. But we do have a organization that we can refer people to as well, because people do have very big health anxieties about STIs as well.
So could people go to that place directly themselves if you gave me a link, or do you have to refer them?
No,
so they could.
We can refer. They can self-refer as well. So we do provide. So we give the option. We can refer them, or if they want to refer themselves, they can do so.
If you could do me a favor, if you could drop me that link, and I will put it in descriptions, because I think,
no
great.
problem at all,
Okay, so let's talk about normal, usual testing when people go to a clinic. So what are your normal tests?
So we've got a variety of tests that we tend to do. So if somebody has a vagina, then we can test for chlamydia and gonorrhea as a standard test. That is usually a self-taken vaginal swab. If somebody has a penis and they just want a standard test, then we get them just to do a urine sample. Then for a blood test, depending on what their sexual history is, if it's just a non-risky, let's say, history, then our standard blood test would be HIV and syphilis. But then if we then take the sexual history, and if people are also having, so let's say someone with a penis is also having inserts, so basically the bottoming, then we would also offer a rectal swab as well, which they can take themselves. If they've been received, so if they also give oral sex to a penis, then we also offer a throat swab as well. And all of those are looking for chlamydia and gonorrhea. If people, let's say, so for example, if people have multiple partners, so let's say people are collaborators, sex workers, etc., we would then generally also test for hepatitis B and C as well, because it's generally, statistically, it's seen higher rates in people that have multiple partners as well. And hepatitis B is something where you can self-clear, but we do also offer vaccinations for those people as well.
So it's not a case of you're saying, if you're a sex worker, you're dirty and you need more. It's you've got multiple partners, you're just higher at risk.
Yeah, absolutely. And you don't have to be a sex worker for that. Obviously, we have no judgments, and we don't assume anything in the clinic. It's face value, and that's literally what we do. And we help people with their risks.
From my experience, I've just known sex workers to be a bit more on the ball with tests and stuff. And what we do, obviously, we've briefly spoke about things before, is sex workers check each other's certs beforehand, and it's pretty much standard. You need to like have all those bloods, So that is quite a good thing that the UK sex worker industry, most people are doing, which I might actually touch upon later. So, all right then. Obviously, you mentioned PrEP before. Actually, no, we're gonna step back. So sorry about this, listeners. So it said that about that's what you expect when you get a test. How often should a non-sex worker get tested, do you think?
So it's all dependent on how many partners they've had, basically, and the type of sex it is as well. So if we generally, let's say for, I know we're going to touch on PrEP shortly, but we generally recommend people come in every 3 months for PrEP users because they have a higher, we have identified that people are having unprotected sex. Obviously, then we'd like to see them more often as well. But it's you know what, it's unfortunate I can't give a straightforward answer because it's all person dependent as well. So I couldn't say, well, if you're having 0 to 2 partners, you need to get tested for that, because it depends on when they had sex as well, because there's different time frames for different infections as well. So what we do, we take on board all the time frames for all the infections, go back to when they've had sex, and we usually tend to go within the last 3 to 6 months of how many partners they've had if they haven't had a test within the last 3 to 6 months. So we would basically just analyze it when they give us their sexual history. So it's person dependent, basically. But if somebody is works as a sex worker or has numerous partners, different partners as well, we would usually say 3 months, or actually maybe less as well, because with the most popular STIs, chlamydia and gonorrhea, they usually start showing up in a test run about 2 weeks plus. So if you've just had sex like 2 days ago with a partner, then you test, you may not pick it up. You need to wait 2 weeks for it to actually show up in a test.
So let's say I'm not a sex worker now, and I just go out and I get a new partner every week just because I'm on the pull and I'm just being a lad's lad and that's what I want to do. What would you recommend for me?
So again, it depends on how often in like a week, let's say, you have partners as well. So
one new one a week. Let's just go like that.
One a week. That's fine. Okay. So it also depends on what sexual activities you're doing as well. But
okay.
We're just doing it in just a simplified version, then you probably could go for like 1 month. I would probably say every 4 weeks.
Okay.
The reason is that you're splitting it into 2 then. So you've got the 2 week plus for that one. And then if you've basically got to count 2 weeks after each partner. But it also depends on what type of sex you're having. If you're having the type of sex that could be higher risk of transmission of syphilis, HIV, then you'd have to test later on as well with your bloods.
So that's 6 weeks, isn't it?
So for syphilis, it's 90 days.
And
for HIV, it's 45 days.
Okay.
Yeah. So we usually recall people for the HIV one or the syphilis one if we feel that they actually may have been at high risk of a potential transmission as well. And what I mean by high risk is basically bareback sex or condomless sex. So the time frames we're always keeping in account, but it's person specific. But if people basically just need to think that, when was the last time I had sex? Is it over 2 weeks ago? Right, I'm okay to test now. But you may have to then think about going a bit further along for blood tests as well.
Yeah.
That's why I'm in a job, because I can advise that as well. So anybody, regardless of what they do, can always contact their sexual health clinic for information regarding time frames and window periods and things like that as well.
Because what I find is quite handy is, for those who don't know, I live in Wales, and in Wales we have Frisky Wales, and that's just go on the website, ping your details, and they send you a postal kit. And we spoke about this. You can do it as often as you like. So this whole time frame thing, that really helps with,
Absolutely, because you then can tailor make your tests as well. And you can even, which you've experienced probably through Frisky Wells as well, you just tick what test you want as well.
Yeah.
So, and it dependent on what type of sex you've had.
Yeah,
so
I accidentally clicked to order a vaginal swab last time, and I was like, it obviously realized you're a dude, you don't have a vagina.
Yeah, but that is the same swab you'd have for a rectal swab or a throat swab. So you could technically use it for a throat swab.
Well, right? Yeah, I could have done, but it wouldn't let me. It was like, you don't have a vagina. It's like, you're not having it.
Very presumptuous as well, Frisky Wales, isn't it? Clearly.
Yeah. Actually, speaking of penises and vaginas, do you do anything different for trans?
So no, not really. It just depends on that person themselves. So the reason why I'm not referring to people as women and men is because of trans women, trans men as well. So if I just keep saying guys do a urine test, well, guys could refer to a trans man with a vagina. So they would have to do a vaginal swab, and vice versa. If it's a trans woman, they may have a penis. So they would do a urine test if they top sexually still as well. So again, it's all tailoring it to each individual person. But yeah, I mean, what we have seen as well is increase, again, we're going to be talking about it shortly as well, but increased HIV transmission with trans people as well. So if somebody identifies as trans and they have high numbers of sexual partners, we would help them get onto PrEP as well. But it's all dependent again on what anatomy they use for sex as well. So we don't do gender, we do it off their anatomy and then we obviously, out of courtesy and respect, we want to know what their pronouns are and how they identify as well. And they feel comfortable coming to us because it's a respectful environment and they feel comfortable generally to be themselves as well.
Good, that's great. So we've mentioned PrEP several times. You mentioned it again then. Would you like to explain what PrEP is?
Yeah, absolutely. I live and breathe PrEP, so this is my topic, PrEP. So yeah, PrEP is pre-exposure prophylaxis for the long term. And basically, long story short, PrEP is basically a medication that stops the transmission of HIV. With any medication, obviously, it's all dependent on how you take it as well. So you're basically, for your criteria, what our criteria generally is that if you've had any bareback sex or condomless sex within the last 3 months or intending on being like that for the next 3 months, if you identify generally as bisexual, gay, men who have sex with men, trans females, and intending on having bareback sex or condomless sex, then we would recommend PrEP. We'd make sure that you are HIV negative to start with, and we'd also need to check your kidney function as well. And that's a really important issue with PrEP, is that we really closely monitor your kidneys every 3 months as well. And it's just to make sure that your filtering in your kidney is still up to a certain level while you're taking the PrEP as well. So it's one of those where it's a really good medication that not a lot of people, believe it or not, know about. And it's a lot of people that is and I don't like the term, but it's basically people who have opposite sex partners, or the hetero community, as people say it. But it's not really well known there. And for some people that identify as a heterosexual, let's say, and they have opposite sex partners and that's it, then they may not feel, and they may not actually need it, but they may know somebody that needs it. So it's really important to get the message out about PrEP.
I actually went into the discussion, sorry for cutting you off there, and it was with a hetero woman, and it was talking about arranging scenes and stuff like that. And I obviously, my kidneys are a bit weak. At the time, I was like, not taking PrEP, don't want to damage my kidneys anymore or anything. And I said, I use condoms in all my scenes, just I can't take PrEP. And when I said that, she was like, oh, so you've got AIDS? I was like, it just didn't know. She just I was like, no,
Yeah,
it doesn't mean, because it doesn't mean that.
absolutely not. No. And we do actually have a lot of people, instead of referring to HIV, they refer to it as AIDS
Yeah,
as well. So, and that's where our health promotion as a sexual health nurse comes in, with the education part of it as well. With, I mean, we can go into it a little bit further, but HIV treatment is so effective now, where people are on literally just one tablet a day, and they have an undetectable viral load, and
yeah,
they can live just a normal, healthy life. And some people that are living with HIV actually live longer than somebody who doesn't have HIV, because we monitor them so closely.
that's what I was about to bring up then. So obviously, if someone does have HIV,
Yeah.
they can't take PrEP. You were saying, because I'm assuming that's just because it does nothing for them.
It's not a case of that, because PrEP is a HIV medication.
Okay.
Uh, so what's the reason why we have to absolutely check that they are HIV negative is because if they are HIV positive and it's unbeknownst to us and we prescribe them PrEP, it can cause HIV resistance. So, because they need to be on the exact right tailored regime for their strain of HIV.
Okay.
So, so they it may so basically it may cause resistance. So for the future, it might be very difficult to get their viral load down. So
Okay.
that's why it's absolutely imperative that we need to know they're HIV negative, and that goes in with the time frame again as well. We won't start it until we definitely know they're HIV negative.
So now we've got a person who is HIV positive,
Yeah,
but you're talking now about viral loads and treatment and getting
yeah,
them to be undetectable. For those who don't know what that means, would you like to explain?
absolutely. So you have to have a certain amount of the virus in your blood to pass it on to somebody. If you take your medication and you're on the right regime and you take it how you're prescribed, you can get that amount of HIV virus in your blood so low that it can't be detected on a blood test anymore, which means that that virus is so low it can't actually transmit to anybody. So you literally cannot pass HIV on. So that's how well HIV treatment is now, is that you literally cannot pass HIV on. So they call it undetectable equals untransmittable, and it says it all.
I've actually seen posters for that.
Yeah, yeah, good, excellent.
Yeah.
I'm glad to hear that as well, because that's what it should be like. You should actually see it everywhere as well, because again, not a lot of people know about the untransmittable, undetectable, untransmittable as well.
Yeah. I actually only learned about what undetectable meant last spring. So
Oh, there
just
you
over a
go.
year ago. And before then, I thought if someone's got HIV, it's just you can't, it's you're gonna pass it on no matter what, unless you wear a
Yeah,
condom. And still, then I was a bit,
yeah.
you know, it's a very naive point of view to have.
I wouldn't, do you know what? I wouldn't say it's naive, and I don't think anybody should feel bad not knowing it, because I just don't think the education is there, and I don't think that we're doing everything that we can, and that's why I'm talking about PrEP, because I also talk about HIV positive people living with HIV as well.
Mhm.
So people are doing as much as they can, but it's just trying to get the whole community involved with that and getting the message out there as well. So I don't think it's a sort of like a self naive thing. It's just because you literally just don't know, because the information isn't there.
Yeah, pretty much.
Yeah, absolutely.
Okay, so obviously we're saying the awareness isn't out there that much. Do you, is there things being implemented at the moment that are trying to improve that, or do you think there's still not enough?
Yeah, well, there's something called fast track cities. And generally, what they're actually trying to do is to aim to have no transmission of HIV by 2030. And what it basically means is fast track city is that there's a lot of cities around the world that have signed up to this target, and so have we. So in the UK, London, Cardiff, different cities have, and North Wales is now on the road to signing up for this as well. So it sounds a big ambition to have no HIV transmissions, but we have got the medication there, we've got the facilities there. So if you're thinking again, like we were just talking about, if you're living with HIV, if that medication is spot on for you, which we will obviously monitor, and if you're taking it how you should, you can't pass that HIV on when you're living with it. And if you are at increased risk of potentially having a transmission of HIV to yourself, you can be on PrEP, which will stop you getting that HIV. So that's why it's so important to get the message about this untransmittable, undetectable equals untransmittable, and about PrEP as well. So that is a big thing going on at the moment, is fast track cities. And I would probably say I'd probably say in the next couple of years, it's really going to take off, because it's, they're giving themselves a realistic target of 2030 as well. So they've got another 8 years to go. But that is a big thing that's going on at the moment. And then you've got so many different charities as well. You've got Terence Higgins Trust as well. They're always doing campaigns themselves. You can sign up to marathons as well, or 5Ks and things like that, to sort of make awareness of the being undetectable with HIV and PrEP. There's also Prepster as well. I would really advise people to go to the website of Prepster, and I can give you that.
Yeah, give me the link, please do.
Yeah. And then people can click on there, and it will tell them where they can get PrEP there as well, if they just look at different services as well.
Yeah, I think it's all well and good, all the stuff you're saying, but I just don't think schools are doing enough.
Well, they're not, absolutely not. I mean, when I was, many years ago, there really wasn't any. Well, it wasn't even talked about same-sex at all. It was,
but all of it wasn't discussed when I was anyway.
Yeah, no, absolutely. It was basically focused on periods. I mean, the stuff that they have covered, don't get me wrong, it's still vitally important, but they really don't cater to people in a minority groups at all. And they're really not progressive in the slightest at all. And I think it could, I mean, there's many aspects as to the reasoning why, but if they were more progressive, and if they included more minority groups as well, then I think we would dramatically see a difference with the generations going forward, with their attitudes towards sex and safer sex as well. Because sex should not be a taboo subject. You should be able to talk very openly about sex, because it's being part of being human at the end of the day. And the more open you are about it, the more comfortable people will be about talking about their issues as well. So it's a big cyclical thing, and very passionate about being comfortable talking about sex. So schools should be, absolutely, but they should also be talking about more about consensual sex, and they should also be talking about how to enjoy sex as well, because that's a big issue as well in terms of enjoyment. People are going through the motions because they feel that's what you do. It's listening to yourself and what you enjoy with sex as well, and how to get the most out of sex.
So if there's any headmasters listening or anything, pull your thumb out your arse and take that on board. If there's anyone who wants to start a charity that's aimed more towards getting schools involved, I'll be honest, I wouldn't have a clue where to start with that one. And I don't think I'd be the right person to start that one. But, I've got a hell of a lot to learn. But I think this is something schools should implement across country. Maybe like every year they have 2 days as like sexual health thing for the entire school. So they've got through high school, 7 years in high school now?
Yeah, I think so. Many years ago, remember? Don't know.
And they're just going to have this every year, and there's going to be giggles, there's going to be laughs, but by the time they're an adult, they're going to fully know what's what.
Absolutely. And that's the key, because it's just, if you look at personal experience, it's not until later on, a little bit later on, where you realize, looking back, you may have been actually taking these risks that you shouldn't have been taking because you weren't informed about it. So it all starts in school, because that's the whole you're educated in every single subject possible. Some subjects you probably will never use again, but the majority of people will use sexual health.
Yeah, I was actually about to say then, there's a lot of subjects I've learned at school that I've never touched, but I think I know every person has had sex from my school.
Exactly. That's the thing. So that going forward, they need to really focus on that because my God, that's a gap. That is such a gap. It
Yeah,
really is. It really is. So yeah, so absolutely. If anybody's listening that wants to start a campaign, start education, things like that, then please do.
yeah,
Absolutely.
perfect. Okay, there's something I want to touch up on with PrEP as well. You mentioned about obviously it tends to be offered to same sex, bisexuals, gays, all that spectrum. But how come it doesn't get offered to women as much? Do they get offered if they're in the sex worker industry or?
So it tends to be more for the sex worker industry, and it's the reason being is that they have a lot of different partners. Now, don't get me wrong, in certain situations, we probably do feel that more people should be on PrEP as well. But we are also looking statistically as well,
Mhm.
and who is potentially more at risk as well. So yes, so women, but it could even be if we would offer it to women, let's say if they, regardless if they're a trans woman or cisgendered woman, if they had a partner who is living with HIV and they weren't taking their medication how they were meant to be, and they are detectable with their viral load, that is the point where we would probably suggest actually safety wise, due to an increased risk of transmission, we would advise them to go on to PrEP. And then as soon as that their partner, if you know, obviously every situation is different, but as soon as their partner is undetectable and it maintains that, they can come off PrEP. Their partner can come off PrEP.
What if, just so I'm going to give you an example, there's just a
Yeah.
woman who is a sex worker, she works in the industry, and she's filming with 1, 2, 3 guys a week, new guys every week.
Yeah.
Would you say to her, yeah, you could go on PrEP?
Yes, absolutely.
Yeah,
Absolutely. Yeah.
because
So and
a lot of
sorry.
women I know, they don't think they can.
Yes, they can. Yeah. It's literally part of our criteria. So
Okay.
yes, absolutely.
Where do these people go to get PrEP? Whether it be Wales, England, Scotland, do you know?
Every single sexual health clinic offers PrEP.
Yeah. So
Every single, it's all free on the NHS now.
all
So
of it.
yeah,
Okay.
NHS, it's all free on the NHS. Took a while, but it's all free because England, with the last ones, Wales, we've been doing it for quite a number of years now, but England, just basically due to political restrictions and funding, etc., they finally got it, and it's now on the NHS free. Well, free as it can be, if you see what I mean, on the NHS. But yes, they don't have to basically pay for it privately.
Yeah.
So yeah, no, sexual health clinics. That all they need to do, go on the website, give them a ring, and just inquire about PrEP. And everybody is trained there to see if they meet that criteria for PrEP. But again, it's an individual thing as well. We work to a criteria for PrEP, but if we can you always use our clinical discretion as well. If we feel that that individual is potentially at a higher risk of PrEP, so let's HIV. So let's say if we've got somebody that's going over to Thailand, let's say, where HIV transmission is quite high there, and they go there purely for sex, and they have a lot of sex there as well with different people, we would then advise them to go on to PrEP. So
Okay.
it's a very individual thing as well that we can assess them for.
All right. Okay. I didn't really think of that. And PrEP's absolutely fine to take abroad. They don't get stopped at customs or anything.
No. It's all fine. Yeah, all fine. Just the same as any medication. Yeah.
Yeah. Just thought I'd double check on that because,
Yeah.
yeah.
No, it's very handy to know, absolutely, and especially for people like sex workers as well. If they're going abroad to film as well, if they're collaborating with people abroad and things like that, and if they're on PrEP, they need to take it with them, obviously, don't they? So
Yeah.
it's really important to know that if they can get through customs and everything with it. And obviously, it's an individual thing with each country, of course. So the person whoever's going to that country does need to check the laws, custom at each country. But generally, it's treated like any other medication.
Okay. While we're talking about treatments,
Yeah.
shall we talk about treatments for your basic, not basic, but your other common STDs?
Yeah,
or
of course.
STIs?
Absolutely. So let's start with, as I said, our most popular STIs is chlamydia and gonorrhea, the majority of people go for. And so let's go for chlamydia. So the standard treatment is something called doxycycline. So it's just basically antibiotic tablets for a week. If they, I mean, I won't go too technical with it, but if you have chlamydia of the anus, then you would, if you identify as a general broad spectrum, a man who has sex with men, then we would automatically test it for something called LGV. And LGV is a different strain of chlamydia that is found in the rectum and can be quite difficult to get rid of when it's in the rectum. And statistically, it's found more commonly in men who have sex with men who have been diagnosed with chlamydia in the rectum, in the anus. So what we would do is that we would usually start people off on 3 weeks of antibiotics precautionarily. And then we would then get the results back. If it's negative, we would ring that person and say, right, stop taking it, you're fine. As long as you've taken a week, you're absolutely fine. But if it is LGV, then they would need to take 3 weeks worth, because it's all to do with basically the mucous membrane in the rectum, the anus itself. Can be harder for the antibiotics to get to there if they've got this strain of LGV. With LGV as well, you can get some symptoms with it. So it tends to be something called proctitis, and that is basically a lot of pain in the anus. You can get a lot of mucus and blood as well, and very painful even passing stools and things like that as well. So that's why we would really need to be on it with LGV as well, and we would ask if they've got any symptoms. If they have got symptoms with chlamydia infection, we would automatically assume it's LGV. So we would anyway just treat them for LGV and give them the 3 weeks. And we'd probably continue with that 3-week course anyway, because that will then really help with getting rid of that infection. So, but chlamydia, in terms of a standard treatment, is that week's worth of antibiotics. Gonorrhea is an injection into the buttocks as well, which isn't favoured by many as well. So it's actually not, and I get asked this quite a lot on a daily, because obviously I treat gonorrhea quite often as well. And I get, when I say it's in the buttocks, people then get confused that it's actually, they think it's going to be in the anus itself, and they're going to have a needle in there.
I've never heard of anyone thinking it was going to be that.
Oh, they do. They do, believe me, they really do. So I have to, on a regular basis, I have to explain, I'm not going to put the needle in your anus. I'm literally going to put it in the muscle, the gluteal muscle as well. So I just don't want people as well, just in case, as I'm saying this, they're thinking, oh my God, you're going to put it in my anus, sort of thing. It really isn't. It's not a suppository. It's nothing like that. It's literally into the upper outer part of the muscle there. So for gonorrhea, it's an injection. We always advise you to do a test 2 weeks after as well, because there are different strains of gonorrhea, and some strains are resistant to the standard treatment as well. So if you do have gonorrhea, we would also get you back. Well, we get you back in anyway for the treatment, but people even listening, they may have actually experienced this themselves. We also have to take a second lot of swabs wherever we find the gonorrhea. And the reason for that is that what we do is grow that gonorrhea in the lab, and to see what strain of gonorrhea it is. I know. We grow it to make sure that that gonorrhea they've got is sensitive to the antibiotics that we've given them. And if it isn't, we get them straight back in, and then we treat them with what we need to as well. But the reason why we do that test in 2 weeks is to make sure that that has hit the gonorrhea and got rid of it as well. So that's a really important point to stress, is that anyone with gonorrhea diagnosis that's been treated, 2 weeks from their treatment, they must get a repeat test.
Okay.
Yeah. So they're the common ones. Would you like me to go through the rest?
How many more are we talking?
Well, there's many more, but I could maybe just go through syphilis, maybe.
Yeah, please do.
Yeah, syphilis is on the rise, and it's a very, I wouldn't say common, but we do see it fairly regularly now as well. Syphilis, it goes in 3 stages. The first stage, you have something called a painless chancre. That basically means you have an ulcer, but it's painless. So people can have that in their mouth. They can have it inside their anus. They can have it outside their anus or anywhere around the genitals. And the way you actually transmit it is through contact with that ulcer. Now, let's say if you're giving oral sex and you've got a painless ulcer at the back of your throat, you won't know it's there because you're not having any symptoms because it's painless. So you're then, let's say, given a blowjob, then you're then potentially transmitting that syphilis at the back of your throat. The penis is going to be touching that ulcer, and that's how the syphilis is transmitted to that person. And then that person will then end up with syphilis and have a painless ulcer somewhere. And then that's how syphilis is passed on and on and on. It's a very strange one. It's the actual symptoms can be various as well, because you can also have rash all over your body, or you can just have them on the base of your feet and the palms of your hand as well, and that's an indicator as well. Syphilis is a blood test. So
I was going to say, in the basic tests that you get at clinics, is syphilis thrown into that?
Every person gets tested for syphilis.
Yeah. So the person who has it in the throat, if they're getting tested regularly, it's very unlikely.
So if they are unlikely with what? Sorry, that
they've got it. If I'm working the industry, if I'm working with people who get tested every month, they would know normally if they've got it.
Oh, yes, absolutely.
Because as you're saying they might have an ulcer in the back of their throat they don't know about. It's not painful, and I'm just like, what am I doing working in porn?
No, I'm not saying. Oh, no, I'm not here to put people off sex and put people off sex work at all. I'm here to just basically give information to people to work with them.
To be careful.
To be careful, absolutely. Because the thing is that you're out of action if you end up with STI, aren't you? So
yeah. So we were saying syphilis then, you're saying I'm out of action, but syphilis isn't curable, is it?
Yeah, it is. Yeah, it is.
Okay, go on then.
Yeah. So it's a bacteria. So the bacteria is something called spirochetes. I've got actually so if you're watching on video, you'll actually be able to see this, but I was actually given an embroidered spirochetes for my birthday. Okay. So I'm probably one of many people that I can say I was given syphilis for my birthday. So and I was quite happy about it as well. So because it's beautiful. But I don't think a lot of people would be that happy. Let's say.
So for those who are listening, that's like a petri dish of syphilis.
Yeah, and the bacteria is literally spirals, and that's why they're called spirochetes. And so so syphilis is a bacteria, so it is curable. But what actually happens though is that if you end up with syphilis and you've been cured, so you've been treated, then it does have a little what we call a marker in the blood for the rest of your life. So it will show that you've had it previously for the rest of your life. So that's just, it won't affect your sort of day-to-day activity or anything like that. It just shows it's been in the blood when you have it.
So someone's got syphilis. Let's say I was given name. Amy's got syphilis. She's been treated. She's been cured.
Yeah.
Will that just come back randomly and just flare up?
No.
So it's not like having cold sore on your lip.
No, that's herpes. That so we can get.
Oh God, yeah, that's when I'm mixing things up.
Yeah. No, and we can go through that as well because it's important to differentiate them as well. Absolutely, but no, syphilis. So it can show like a herpes because of herpes you can get ulcers as well. So yes, quite right, but it's the opposite. It's super painful herpes. So and I'll go into that shortly why it is. But so syphilis is treatable. But it's one of those where it will. So if you're doing your frisky whales or your test and post kit, it will show that you've had syphilis antibodies because you've had it before. So, and it's nothing to worry about. It's just, it recognizes basically that you've had syphilis before, and that's it.
Okay.
Syphilis at this moment in time, because I'm aware that this will go out and people may listen to this years in advance as well. At this moment in time, syphilis is treatable with 2 injections into the buttock. And if they are at as I said, there's 3 stages. The first stage is you got this ulcer. Then the second stage, you can get this rash. What happens then is that syphilis then burrows in the body. and then you become what we call asymptomatic. So you don't have any symptoms at all. But what's actually happening with untreated syphilis, it's damaging your body, and it can get into your spinal cord fluid and go right up to your brain and cause dementia.
Okay. So that's what you heard from like the old artists and stuff back when you went a bit nuts.
Yeah, pretty much. May have been syphilis. And it can affect all sorts. It can affect your eyes as well. It's as beautiful as it is in that lovely embroidered petri dish, it's really not a nice STI to have if it's untreated.
No, so what about herpes then? What's the situation with that?
Yep, herpes. So herpes is a virus. It's not a bacteria. It's a virus transmitted through skin-to-skin contact. It is the cold sore virus, basically. There's two types of it as well, which a lot of people may not be aware of. So there's type 1 and type 2 we diagnose. Type 1 is the one that basically generally originates from a cold sore. And if you have cold sores, then you have the herpes virus, basically. It's just in your mouth or by your mouth. If you then give oral sex to someone with a vagina or someone with a penis, then you can transmit, if you've got an active cold sore, you can transmit it from the cold sore to their genitals. And then they end up with herpes in the genitals. Type 2 is the one that generally we see more in the genitals. And type 2 is the one that people tend to have more episodes of herpes symptoms and herpes breakouts, we call it. But the actual symptoms itself for herpes is you can get blisters, ulcers, tingling, like a rash, tend to be in the same place each time as well. The reason why it's so painful as well is because herpes is a really sneaky virus, and it actually lives at the base of your nerve cells, and it can remain dormant for years. And then all of a sudden, like that, it can just raise its head again, and it travels along your nerve cells. And that's why it's really painful. With some people, there can be complications as well, in terms of, we always ask if someone's having a herpes outbreak, we always ask, when was the last time you passed urine? Because people can actually go into retention, which basically means that they literally cannot wee. And then if the urine backs up, it can damage your kidneys as well. And that would mean they'd need to go to emergency department. So we would always assess basically when they're not weeing. So if somebody has herpes outbreak and they're not weeing, we usually say 12 hours, they need to probably by that point go to emergency departments. So it can be that painful basically where people can't wee as well.
That's the one that's not curable.
It's not curable, unfortunately. And the reason why it's not curable as of yet is because it lives very sneakily at the base of your nerve cells, and it's very, very difficult to get rid of.
Well, I'm going to jump ahead actually, because we've had a couple of questions.
Yeah.
One of them is actually related specifically to this.
Okay.
I did forward it you on very shortly before we actually went on this Zoom, just to skim, because I thought you might want a heads up on this one.
Yeah, it's fine. Yeah.
So someone said, my very best friend contracted herpes when she was 20. She's had to live with the condition. It's massively affected her. She was not allowed to give a natural childbirth to a son. She had to have a C-section because of it, just to reduce the risk to the baby. She was heartbroken for a friend. She had to miss out on that experience of giving natural birth. Why is there no cure for herpes?
So it goes back to...
Sorry, your voice is cut out. I can't hear you. Don't know why. There you go. Talk again. Nope.
Oh, hang on.
There we go. Got you.
Yeah. Don't know why it's the connection. I don't know why it was saying that. So with herpes, it's very hard to basically in terms of cure, because it's a very sneaky virus and it does hide itself in the base of nerve cells. And there are people out there that are trying to cure all of these viruses as well. It's just very difficult to do so. So What we do, though, is we do monitor people if they have been diagnosed with herpes, and we monitor how many outbreaks they do have. So, as standard, if they have 6 episodes of herpes outbreak within a 12-month period, we can actually put them on antiretrovirals. So, basically, antivirals, which means that we can try and help them suppress that virus. And we do it in terms of they take it every day for usually about 6 months altogether. And then they would come off it and see what their episodes are like after that. With this individual case, I mean, it's obviously heartbreaking because they didn't get to have that experience, of course. And it is a fairly common thing that we actually see as well in our job, is that we do see people that are with child, and they have herpes outbreaks, and it's basically all to do with their immune system is low because they're giving all the nutrition to the baby. So what happens with your immune system is that it lowers, can't fight that resistance it has with that virus. So that virus then goes, great, fantastic, I can start living and breathing now. And it gives them that episode. What we would do then is that we would refer them to the midwife to make sure that midwife knows they've got herpes, first of all, and that they've had an outbreak. It's then up to the actual consultant and midwives themselves to see whether it's safe for them to have the child naturally. Because if they are having a current outbreak and they're due to deliver in the next 2 days, it wouldn't be safe then to do a natural birth, because you can pass it on to your child when you're giving birth, and it can be fatal to the child as well. So it's an individual. So that, again, I don't know, obviously, their clinical history and their clinical circumstances, of course, but the rationale may have been that in terms of their outbreak, it could have been time, it could have been the amount of outbreaks they were having leading up to the birth. The consultant may have thought it's going to be quite risky to do a natural birth for the child, so let's go for the C-section where there's no risk there for transmission to the child. So that could be an explanation. But yeah, in terms of curability for it as well, as I said, there will be people out there trying to cure it, but I mean, there's nothing.
I assume that was going to be the case. It's they're trying to cure. They're not just going to leave it. They're just going to go, yeah, we'll do C-sections left, right, and centre for people with herpes.
No, absolutely not. No. Every single virus they are trying to cure behind the scenes. Every single one. They don't like leaving them, but some are just really, really difficult to cure.
Yeah. You're right. So obviously we just answered that question. I think it's quite a nice segue to just go into answering a few more. One of my sex worker friends, he is asked, why do certs cost so much? And certs, meaning, for people who don't know what that means, is like a certificate, your breakdown of sexual health. Obviously, for a lot of areas in the UK, it's privatized certs. To get a full breakdown, you need to go private. Not a lot of areas in the NHS are willing to give out breakdowns. Do you know why that is, or?
It could all be done. I mean, I can't speak for every service, obviously, but from my experience, let's say, it's all to do with information governance, GPDR, all that. It basically all goes down to that, and also it goes down to technology as well. Some services actually don't have the actual technological capacity to do a breakdown like that. They would all have to free text every single one. So
okay,
it would actually be down to the technology. The more advanced, let's say, services like the inner city ones as well that have a real good funding tend to have technology that is basically geared up where they can just swing off a PDF off the results straight away. There's even people with apps, places with apps where you can download and then get your results that way.
I was about to mention that. I've actually heard that it was in the grapevine, Wales is developing an app. Is that true?
That's news on me, actually. I know there are different things in the sort of like the background that's going on.
Okay.
It could well be, though, absolutely. And if
fingers crossed.
Exactly, that is going to be amazing. It really is, because generally Wales is usually a little bit behind England in certain things. I think with services we generally are as well.
I'll be honest, from the sex worker side of things, because I speak to most of the people I know are from England, and they really struggle to gets tests really quick. Like with the frisky whales, get them really quick, sent off really quick. We'll get a breakdown if we need it. But in England, they get like, you have to pay out the nose like 130, 140 pounds to get a postal kit. And say it's not, all right. So there's one postal company which most use, and it doesn't actually include a oral swab or an anal swab. They have to then pay more again to get that done.
Yeah.
And
it's I mean, again, I would probably say it may be down to, it's a horrible thing to say, but money. I think it could be a money sort of scheming thing for that. Exactly. I can't see the rationale why they wouldn't offer it as a full package, really. But they probably don't, because they feel that people do need that extra one to get the certs to do a scene.
Yeah.
So they're quite savvy, these people. They know who are using their services. So they know the types of things that you need to actually go ahead with a scene.
Yeah, I do believe there is free testing in England, but I think you're only allowed it so often.
Again, I'm not really up to date. I'm fairly focused on our one there, but you're right though. There are tests for free under sort of Public Health England, etc. You can even get some tests from pharmacies as well for chlamydia. I don't think they're doing gonorrhea, but they're at least doing chlamydia. But you need to get the gonorrhea anyway, of course. So you may as well go for your test and post. But yeah, I don't agree. I'll be honest with you. I do not agree with having to pay for sexual health test kits at all. It should be fully funded, fully integrated in the NHS. It is a health need, and that's that. It's just as simple as that. So I do not agree at all that you have to pay for it. And it's really sad that I hear that that sex workers have to do that as well for the certs. It's really sad that you have to do that. I really disagree with that completely.
Yeah, I mean, there's a brilliant charity down London that most sex workers know, Dean Street, which I'm assuming you'll be aware of. But what I want to say is, because Dean Street, to a lot of sex workers, it's the be all and end all. But getting your tests done elsewhere, they're the same tests, aren't they?
Literally, yeah. There's no change in the test at all. There's no test is better than the other. We all have to meet a certain standard with the tests. So as a whole in the UK, we have to have the same test standards. So doesn't matter where you're going, it's going to be the same test. So absolutely, you can go to any sexual health clinic and they will offer you the same tests as anywhere else. Yeah, absolutely.
But what I will say about Dean Street, I mean, it is brilliant how they have a quick turnaround and stuff, and you do get the breakdown, but it's not the be all and end all. If you live 7 hours away, use the one that's near you. Just being a sex worker, obviously we know that you need to have a breakdown to do scenes,
I know, absolutely. And I do hope that the certain services that aren't doing that at the moment will progress with that and help actually sort of give that to people. But it can literally, it can't be a case of, it's not usually a case of, oh, they won't as well. It's a case of they physically can't because of that.
That's good to know, though.
Yeah, absolutely.
Yeah, we don't think that it's just a place being lazy or doing us over.
No, absolutely not. No, I would be literally sending them off all day if I could. I really would. It's just unfortunately where I work, we don't have that technological advantage at this moment in time. Eventually we will.
That'd be amazing. Okay, on to the next one. I quite like this one. What are the long-term implications of depending on antibiotics for as solutions? Hold on, I'm gonna read that again. I got tongue-tied. So, what are the long-term implications of depending on antibiotics, a solution for usual suspect STIs, rather than taking the necessary precautions like testing and asking for certs? There are a fair few people out there who need to hear this answer, I think. So this person clearly knows the answer, but what they're saying is, all right, I'll let you go into that.
No, it's fine. So yeah, so basically they're probably talking about like a prophylaxis antibiotic, and that basically means like precautionary use of antibiotics. So what that would basically mean at the end of it is you'd be creating resistance to the infections. So the infections would basically, they're very scheming, these STIs as well, and if they see that constantly in the body itself, they will find a way to build itself where it becomes resistant to that antibiotic.
Mm.
So people start using prophylaxis sort of antibiotics. So basically taking antibiotics, just say after a scene, they go on a week's worth of antibiotics precautionarily. If they keep doing that, there is a chance that it could then end up being resistant to STIs. So they're better off testing instead of taking medication precautionarily.
I also think that this person's not just hinting at that. I think they're also meaning, oh, people are just, they're not asking for certs and they're just going around, just going, right, you're on prep, I'm on prep. Let's shag. Worst comes to worst. If we have something, we'll just get treated. So
Oh, no. No. They shouldn't be doing that.
exactly.
Yeah.
I'm going to say this now. This is a really big issue. There's a lot of people in the sex worker industry who check certs. Standard rule is get tested pretty much every 4 weeks. And when you can do a scene with someone, you see each other's certs. You want to see a full breakdown, and then you do the scene, obviously based on it being clear or you being comfortable. Say if someone's undetectable, find they're undetectable, that sort of thing. But there's a percentage of the industry, and people aren't openly speaking about this, and I'm happy to speak about it, where there's this attitude of we're on prep, we ain't going to get the big bad, we're fine. If we catch something, we just take some doxycycline, and then they just crack on. And that is a huge issue in my book.
Yeah, absolutely. And yeah, I would agree, because then they are pretty much promoting the spread of STIs by doing that. They're not taking precautions. They're not, and basically they're also not thinking about their future sexual partners as well.
Mm.
Because doxycycline isn't the cure for every STI as well. So they really do need to be testing as well, because it could be looked upon as a selfish thing, because they're really not. You've always got to think about your future partners that you're going to be collaborating with as well. You want to protect them, obviously, as well as yourself.
Mm.
So if collectively everybody is taking responsibility of their sexual health and testing regularly, then the STI rates are going to plummet in the sex work industry. So
Mm.
it's for, unfortunately, it is for people that aren't being precautious with testing and taking risks, and that's big risks as well, and thinking that because they're on prep, obviously stops the HIV transmission, doesn't stop other things though, doesn't stop syphilis, doesn't stop gonorrhea, chlamydia, everything under that umbrella doesn't stop that. So that's why they need, and as we've talked about certain ones like syphilis, you don't know, you may not even know you have. So you could then potentially be passing that syphilis on as well. If you had the test, came back as positive for syphilis, you'd get your treatment, you get yourself sorted with that, get rid of that syphilis, and then you go to that scene. You'd have to delay it, obviously, but you'd eventually be doing that scene, and you'd be protecting your partner against it.
Yeah, 'cause I was going to say they're not, even though they're thinking, you just get cured, you'll get treated. They're not thinking about even the people, not just the one they're passing it on to, but then the people they're passing it on to. They might
Absolutely.
pass it on to like someone else, and they might this whole herpes issue with childbirth. You know what I
Yeah.
mean? Think about it. Whoever's listening, if it's you, you're an absolute idiot. If you're not checking, start checking. You absolute bellend. But that's what stresses me, because it really affected my mental health when I've shown up to a scene and I've gone, right, here's me cert, here's me breakdown, and they've gone, oh, you're the first person to ask. It's happened a couple times, and I'm like, what? They go, yeah, you're the first person to ever ask. We just film, and yeah, and I'm like, no, and
No, absolutely. And I think it's good to be cautious about that as well, because it's that trust element as well, isn't there? That if you're showing respect by showing them that you've proactively tested yourself, but if they haven't even really thought about that, then it's a higher risk for you, really, isn't it? And with the sex industry as well, it's also via reputation as well, isn't it? So
Yeah. But sorry, to go back to the
yeah,
original
no,
thing
okay.
that I was bringing up, I just went on a rant because it pissed me off because that's an issue for me. So because of people like that, by just catching things so frequently, antibiotics will eventually not work, won't they?
Yeah, eventually, yes, absolutely. I mean, they'll again. There's people in labs always testing for resistance as well. But that's exactly why, even for like chlamydia, we used to give something called azithromycin as a standard treatment. But because people were taking antibiotics when they weren't, we've had to change the chlamydia treatment to something called doxycycline now as well, because that's better than what it was previously with azithromycin to get rid of the chlamydia. Gonorrhea, it basically the treatment in terms of how much of the medication we inject has doubled as well
Really?
because of how resistant gonorrhea is, because of that, because of people basically not testing and basically preempting an infection, trying to basically treat themselves as well. That's partly what it is. Yeah.
And one thing we've not mentioned is condom use.
Oh, I mean, come on. It's like I literally throw condoms out all day long. I did Pride, North Wales Pride a few weeks ago, and Femidoms went down a tree, and that was fantastic to see as well, because we don't get a lot of asks for Femidoms, but they're a really good viable source of a barrier method for sex as well with people with vaginas as well. But yeah, condom use, that's what they're there for. They come in different sizes, different textures, different flavors. I can't recommend a certain flavor. I don't think any of them are really palatable, I'll be honest with you. But they have that option as well. So yeah, they're very readily available, especially at sexual health clinics as well. You can literally go to the sexual health clinics and collect some condoms. We're more than happy for people to get condoms.
Well, Frisky Wales, so if you're from Wales, they post them to your house as well for free.
They do, yeah, exactly. And that's why it's so simple. It's as simple as that. We would, if everybody, I mean, the thing is, obviously, we work and we live in reality. Not everybody's going to be using condoms for sex. Some people just don't like wearing them. Some people don't like having sex with people that wear them as well. So that is the reality of it. But people that do wear them, or who don't mind wearing them, some people just don't even think about it. So it's that, again, that education element of it will significantly reduce STI transmissions if you wrap it up. Basically, it's as simple as that. But yeah, quite right. It's a big issue, like in terms of, yes, just do it. Wrap it up.
One more question from someone that I don't know if you're going to be able to answer, actually, is how common is prostate cancer for men in the UK?
Oh, right. Okay. I'll be honest. Yeah. I mean, I'm not a walking pie chart, so I really don't know.
I was thinking that's not really under the sexual health side. That's more under general health, isn't it?
Yeah, it is. But I mean, we generally, because prostate is obviously part of the anatomy as well. That part and part of sperm production and things like that as well. So it is, it is relevant to a certain extent, of course. I mean, if somebody comes to us who is a little bit older, an old person, and if they say that they are struggling with weeing as well, or if they're saying that they're getting up at night and passing urine very frequently, we would probably then refer them to the GP to get a blood test, which looks at their prostate levels as well. And so we can refer people if we feel that there is a potential issue with the prostate. But I think if they go to charities that work with prostate cancer, they will be able to give them statistics in the UK to have a look at the most up-to-date statistics. Yeah.
Great. Well, thank you for that. And one more topic we want to go into. It's not an STI, but it's kind of being asked about in the same way. Well, should be getting asked about in the same way when having sexual contact with someone is monkeypox. So obviously right now it's quite new, isn't it?
Yes, it is. Yeah. Yes. So it's something that I'm personally involved with in my job at the moment as well. So yes, monkeypox. I think it's round about 1,500. It could be a little bit more now. Cases in the UK, and it's increasing day by day, and it is spreading as well. So monkeypox is a virus that has basically been labelled as in the media as the gay disease. Okay, there's a hell of a lot of stigma attached to that, and rightfully so. But the fact is that it is actually at the moment primarily being seen in, and they topic this themselves, categorize it themselves as bisexual men, gay men, and men who have sex with men. We in sexual health also add trans men and trans females as well with this. But they're seeing them in that network. And the reason being is that there's generally closer sexual networks with the minority of those groups. So that is why we're seeing an increase there so far. It's been linked to festivals as well. It's been Pride Month as well. So we're seeing an increase regarding that as well. We are starting to see monkeypox cases now with cis females who only have sex with the opposite sex as well. So it is starting to unfortunately branch out a little bit now. So the general things that we're seeing in terms of, and I can talk about this firsthand because I've actually seen monkeypox now many times face to face as well. The general sort of symptoms that you see are lethargy, muscle ache, headaches, cough, and then the physical symptoms are basically just think about the biggest whitehead you've ever had that you really want to pop, but scattered all over the body. But you can also get big ulcers as well. People are also getting ulcers inside their anus as well. And some people have had to been hospitalized with the pain for this as well in the UK. Some people are also experiencing high levels of proctitis, which I mentioned before. And proctitis is a big inflammation of the anal canal, so the base of the colon. And people are having what we call melena. And melena is basically pooing out blood, is another way of putting it, basically, and very, very painful as well. They are getting these little pustules and these blisters all over their body, and they are incredibly painful as well. It can cause scarring as well to people, and the general guidance for people at the moment is that if they are suspected that they've got monkeypox, they need to contact their sexual health clinic, or for us, it's NHS Wales 111, and whatever the equivalent is in NHS England, their sort of NHS England helpline, to seek some advice, because with sexual health, we are seeing monkeypox cases if they've got it in their genitals, these symptoms, and if there's an STI risk as well. So if they've been very sexually active, and so they need to see us anyway, and it's in the genitals, we will see them. That's no problem at all. If they've basically got no STI risk and they've just had a skin-to-skin contact with like the arm or something like that with somebody and they've got it, then they would then have to go to, at the moment it's just all very new and it's all very different in each particular hospital environment, but they would have to go to a specific place to get tested for monkeypox. If they have been in contact with monkeypox and diagnosed with monkeypox, then they would need to self-isolate. The guidance is 21 days of self-isolation. And then the current guidelines for us is that we would then have to bring them back in to do a head-to-toe inspection to make sure there's no lesions visible anymore. And then we would basically de-isolate them. And then we could say that you don't have to isolate anymore. It's not an STI though.
Yeah. I just want to go into this isolation. To 21 days. And the thing that surprised me is the pets comment.
Yes. Yeah. And it's unfortunately, it can, because it's like a what they call like a zoological disease. So it can be transmitted.
So you could pass this on to your dogs, your cats.
Yeah.
And then obviously they're quite free roaming. So if you're isolating 21 days, you got pets, it's lock yourself in the room.
Pretty much.
And obviously, if you got other people in the house.
Yeah, people in the house, then they go through public health, England and Wales, and then they have to have the smallpox vaccination.
Yeah.
And that protects them against a possible transmission of monkeypox. Because monkeypox is through basically skin to skin contact or sharing like towels, so it can live on material as well. And also through, they're saying, through respiratory droplets as well.
Okay.
So when people have a cough, if they're coughing and you're in a very close environment with them, you can get monkeypox potentially that way as well. The thing is, though, it's not an STI. Anyone who is touched and have made contact with a person with a monkeypox, there is a potential. It's only because that it's been seen in sexual health clinics is majority of people have caught it through sex because your skin to skin contact.
Yeah. But it is a case of you're in a busy bar, someone's got monkeypox on their arm, you brush past them, skin to skin.
Yeah, and if you're bare arm as well, and yeah, it's very transmittable. Yeah, so you can get it that way as well, and it's not a very nice virus to get. It really isn't.
So what are the questions we should be asking each other? Say if, for example, I'm going to collab and I going to meet someone, what should I ask them about, like, symptoms wise?
So are they generally, so it depends obviously how far in advance. So I would probably say the day before or even the day of as well, before you travel anywhere or they travel to you. Just ask, are they generally well in themselves? Have they got any high temperatures, muscle aches, coughs? And then have they got any new spots basically that look a little bit different to a usual spot that they get anywhere on their body? Have they got any ulcers, anything like that? Because to start with, they do, and it's a really frustrating virus, this, because to start with, they do just look like little pimples.
Let's have a quick look.
They can look like little pimples, but because it's quite hot at the moment as well in the UK, people get heat spots as well. So people may actually look at them and go, oh, it's only a heat spot, that's fine, I can go to this party, I can have sex with this person, I can collab with this person, that's absolutely fine. But it could actually be monkeypox as well. It's a very difficult virus, it really is. Once it starts producing more, and when you're feeling really unwell, then you know, there's something going on. But at the early stages, it is quite difficult to differentiate a normal spot to a monkeypox, basically. Yeah.
Okay.
So, but we need to stress it is not an STI. It's not classed as an STI. Anybody can get it as well. Doesn't matter your sexuality, your sexual practices, anything like that. It's a very non-judgmental virus, this one. It has no prejudices at all. It'll go, if you've got skin or if you're an animal, it'll get you, basically. It's as simple as that. So everybody does have to be vigilant with it as well.
Okay. All right, then. I think we've covered quite a lot of good topics, quite interesting things. Hopefully some people have learned some stuff listening to you. Absolutely. Is there anything that you'd like to say before we close off?
No, I think that we've covered quite a lot of topics. I do hope people have learned, and I hope people maybe in a positive way questioning their sexual practices and hopefully thinking, oh, maybe I need to be a bit more aware of certain things as well. And I'm hoping even with the PrEP as well, I'm hoping that people are learning more about that and knowing that they are actually eligible for it, and so please ask sexual health clinics for it as well. And just to approach your sexual health clinics as well with any problems that you feel that you may need to talk about. We're honestly the most non-judgmental people around. We will talk to you about anything, literally anything, and nothing shocks us either. We've seen it all. So come and see us if you need us. That's what we're there for. Okay, that was brilliant. And I just want to say thank you again for coming on. Really, honestly, means a lot, because I think this is information that really needs to get put out there for people. I agree, absolutely. It's a pleasure being on as well. Thank you for having me. All right, cheers. All right, well, goodbye, everyone. Thank you.